Thanks for the feedback on that.
No problem. We can have, I think, 2 more groups. Who wants to go next?
We can. Group 6.
Go for it.
Excellent. I will just get that started. One sec. Lovely. Is that visible?
Yes.
Cool. We are doing our presentation on Nipah virus infections as well, as many have before. First and foremost, what is it? It's common annually in parts of Asia, in particular Malaysia, Singapore, India, and Bangladesh. It's a zoonotic disease. This means its source is from animals, and hence major concerns in controlling it involve animals. Being an RNA virus, it functions by replicating its own RNA using the host cellular machinery, and the origin dates back to 1998 in Malaysia among pigs and their farmers. I'll pass that one off to our next group member.
Thanks, Jack. So Nipah virus can present itself in quite a few different ways. It can present itself as a severe respiratory illness, an asymptomatic infection, or encephalitis, which is inflammation of the brain. And some common symptoms include headaches, dizziness, fever, and drowsiness, and sometimes difficulty breathing.
Bats of the genus Pteropus, which are most commonly known as flying foxes, are able to zoonotically transmit Nipah virus to humans indirectly through their consumption of contaminated fruit and/or fruit products, such as date palm sap, which can be contaminated with the urine or saliva of infected bats. Nipah virus may also be transmitted to humans through means of an intermediate host, such as pigs, which facilitates humans working or living close to pigs, such as pig farmers and those living on pig farms, to be infected, and through the infection of horses, which can subsequently infect humans that are handling the infected horses or who consume the infected horse meat. Human Nipah virus patients may also infect other humans through close contact by means of aerosols and through direct contact with infected bodily secretions.
The standard laboratory technique to accurately diagnose the current Nipah virus infection involves the use of RT-PCR from throat swabs to detect virus RNA. To detect past Nipah virus infection, ELISA techniques can be used to detect the presence of IgG and IgM antibodies. To prevent the sickness, the trick is to minimize exposure to sick pigs and bats in regions where Nipah virus is endemic, and also to encourage the use of closed-top containers for palm sap to prevent bats which naturally eat that palm sap from drinking or urinating in them. And you should always maintain constant surveillance and awareness of wherever small outbreaks may appear. There is no currently specified treatment for Nipah virus infection. Instead, infected persons are assisted through supportive care as their immune system hopefully combats the virus. All suspected cases of Nipah virus are isolated to prevent person-to-person transmission, and there's tentative evidence for the use of ribavirin, but it's still in its early stages.
Thank you everyone for listening, and good job to the other groups and to the remaining group. Cheers.
Thank you, guys. And I think by the end of today's seminars, everyone will be Nipah virus experts. But very informative and very clear presentation. So well done to the group, and thank you for your presentation.